Order. I now call the Secretary of State, Matt Hancock, to make a statement. Secretary of State.
Thank you very much, Mr. Speaker. With permission, I'd like to make a statement on coronavirus. Since January last year, and especially since December the 8th, when the world's first clinically authorised coronavirus vaccine was given in Coventry Hospital, we've been engaged, all of us, in a race between the virus and the vaccine. As a nation, we've taken some huge strides forward, and we can make careful further progress today, and we must remain vigilant. I can report to the House that there are now fewer than 1,000 people in hospital in the United Kingdom with coronavirus, and the average number of daily deaths is now 9. This progress means we're able to take step 3 in our roadmap today, carefully easing some of the restrictions that we've all endured. People have missed the things that make life worth living, businesses have endured hardship, and everybody has made sacrifices. And while we can take this step today, we must be humble in the face of this virus. We've all learned over the past year that in a pandemic, we must look not just at where we are today, but where the evidence shows we may be in weeks and months down the track. The vaccination programme can give us confidence, but we must be alert to new variants that could jeopardise the advances that we've made. Today, Mr. Speaker, I'd like to update the House on the work we're doing to tackle variants of concern. In particular, variant B1617.2, which is the variant of concern first identified in India, so that we can protect the progress that we've worked so hard to achieve. There's now 2,323 confirmed cases of B1617.2 in the UK. 483 of these cases have been seen in Bolton and Blackburn with Darwin, where it's now the dominant strain. Cases there have doubled in the last week and are rising in all age groups. In Blackburn, hospitalisations are stable, with 8 people currently in hospital with COVID, and in Bolton, 19 people are now in hospital with coronavirus, the majority of whom are eligible for a vaccine but haven't yet had a vaccine. This shows the new variant is not tending to penetrate into older vaccinated groups, and it underlines again the importance of getting the jab, especially but not only amongst the vulnerable age groups. Madam Deputy Speaker, Mr. Deputy Speaker, Mr. Deputy Speaker, in Bolton and Blackburn, we've taken the approach that worked in South London against the South African variant. We've surged in our rapid response team, 100 people so far, who this weekend visited around 35,000 people to distribute and collect tests. We've installed 6 new testing units, we've brought in over 50 new vaccinators and set up 2 new vaccination centres, as well as extending opening hours and capacity at our existing sites. In Bolton, we've quadrupled the rate of vaccination. We carried out 6,200 vaccinations over this weekend, and it's brilliant to see so many people from the most vulnerable groups coming forward to get the protection, whether it's coming forward to get the first jab or coming forward to get their second jab. All in all, this is the biggest surge of resources into any specific local area we've seen during the pandemic so far. It's been coordinated by Dr. Jenny Harries, the Chief Executive of the new UK Health Security Agency, drawing on all the health capabilities, locally and nationally, that we've built in the last year. I want to thank everyone who's working so hard to make it happen, including everyone at the 2 local authorities, the rapid response team, all the volunteers, including from St John's Ambulance, and most importantly, the people of Bolton and Blackburn for the community spirit they're showing. It's been really heartening, I'm sure the whole House will agree, to see the videos that have been published over the weekend of people queuing up to get the jab. And to anyone who feels hesitant, not just in Bolton or Blackburn, but to anyone who feels hesitant about getting the vaccine right across the country, just look at what's happening in Bolton Hospital, where the majority of people in hospital with coronavirus were eligible for the jab but have chosen not yet to have the jab and have ended up in hospital, some of them in intensive care. Vaccines save lives, Mr. Deputy Speaker. They protect you, they protect your loved ones, and they will help us all get out of this pandemic. Mr. Deputy Speaker, this isn't just about Bolton and Blackburn. There are now 86 local authorities where there are 5 or more confirmed cases. The next biggest case of concern is Bedford, where we are surging testing. And I would urge everybody in Bedford to exercise caution and engage in testing where it is available. Mr. Speaker, Deputy Speaker, I also want to tell the House the latest scientific assessment of this variant. The early evidence suggests that B1617.2 is more transmissible than the previously dominant B1117 variant. We do not yet know to what extent it's more transmissible. And while we also don't have the complete picture on the impact of the vaccine, the early laboratory data from Oxford University corroborates the provisional evidence from Bolton Hospital and the initial observational data from India that vaccines are effective against this variant. This, of course, is reassuring, but the higher transmission poses a real risk. All this supports our overriding strategy, which is gradually and cautiously to replace the restrictions on freedom with the protections from the vaccines. The data suggests that the vaccine has already saved over 12,000 lives and prevented over 33,000 people from being hospitalised, and we're protecting people at a very rapid pace. Last week was the biggest week of vaccinations since the end of March. 36 million people have now had a first dose, and yesterday we reached the milestone of 20 million people having had their second dose across the UK. And I'm delighted to see the figures released by YouGov today, which show that the UK has the highest vaccination enthusiasm in the world, with 90% of people saying that they have had or will have the jab. This was no accident. We began planning the campaign for vaccine uptake a year ago, and I want to thank the huge range of people involved in promoting the benefits of vaccination, from Her Majesty the Queen to Sir Elton John and Harry Redknapp and Sir Lenny Henry, Holly Willoughby and Lydia West, and many, many others. Our campaign has been based on positivity and science, and I'm grateful to everyone, including so many members of this House from all sides, who have played their part. From tomorrow, I can confirm that we will be inviting people aged 37 to come forward before expanding this further later in the week. It's been brilliant to see the enthusiasm people have had when they've been invited to come forward, and we want to make it as easy as possible for people to show that they've had the protection that the vaccine provides. And I'm delighted to say that as of today, people can now demonstrate whether they've had their jab quickly and simply through the NHS app. Mr. Deputy Speaker, since January, we've been following a dosing interval of 12 weeks for second doses. Because the extra protection you get from a second dose, particularly amongst those most likely to end up in hospital or dying, it is incredibly important that everyone comes forward for that second dose at the right moment. The approach we've taken aims to give the most vulnerable the strongest possible protection against the virus. So since January, that's meant getting the first dose to as many people as possible, as quickly as possible. The research shows that this approach has saved around 12,000 lives. Now it's important to accelerate the second doses of all those most vulnerable to ending up in hospital or dying. So our vaccination strategy for all parts of the UK, including the areas of surge vaccination, will stick by the clinical advice set out by the JCVI. First, prioritise anyone over 50 who has not yet been vaccinated. Next, second doses to those over 50 are vital, which will now be done at a schedule of 8 weeks. Then follow the cohorts in priority order and the age groups as we open them. This clinically approved approach is the best way to save the most lives, rather than jumping ahead with first doses for younger people. While the JCVI, of course, keeps this clinical advice under constant review, we are clear that their advice is the best way to protect those most in need of protection and so save as many lives as we can. The NHS will be reiterating this advice to all vaccination centres and all directors of public health, and I'm very, very grateful to everyone in the NHS, in local authorities and in the whole system supporting this vaccination programme for following it. Mr Deputy Speaker, today's opening and step 3 marks an important step on our road to recovery. We must proceed with caution and care and bear down on the virus in whatever form it attacks us, so that in this race between the vaccine and the virus, it's our humanity, our science and our ingenuity that will prevail, and I commend this statement to the House.
Jonathan Ashworth.
Thank you, Mr Deputy Speaker, and I thank, of course, the Secretary of State for advance sight of his statement. And may I, just at the start, Mr Deputy Speaker, congratulate Leicester City football team on winning the FA Cup on Saturday. The winning goal from Tielemans was one of dreams, and Leicester City fans boast that foxes never give up. And nor do I, Mr Deputy Speaker. So, turning today to the matters before us. Yesterday, he warned on the television that the B1617.2 variant could spread like wildfire amongst the unvaccinated. But does he accept we could have avoided this? Our borders have been about as secure as a sieve. The delay in adding India to the red list surely now stands as a catastrophic misstep. Now, 1 month ago in this House, I urged him to act quickly in response to this variant. The Sanger Institute data today shows rapid increase in this variant, 30% of all sequenced cases in the UK, and that excludes cases from travel and surge testing. Alarm bells should be ringing, because while he offers reassurance that vaccines are effective, we've also heard from Professor Anthony Harden of the JCVI recently, who has warned us that vaccines are almost certainly less effective at reducing transmission of this variant. Now, I entirely appreciate that when questioned, I suspect he won't be able to give a cast-iron assurance about opening up on June 21st. And I'm not going to try and push him into a corner. We all understand that we're dealing with uncertainties. We've got to be grown up about these things. But we do need a plan now to contain this variant urgently. He's said to be considering local lockdowns. Well, I speak, as he knows, as a resident of long lockdown Leicester. So before he takes out his mallets to try to whack moles again, can I suggest a number of things he tries first? Firstly, can he consider surge vaccination in all hotspot areas and go hell for leather to roll out vaccination to everyone? I was listening carefully to what he said about vaccination increases in Bolton, and I hope that also includes Blackburn. Is he saying that everyone over 18 in those areas will now be eligible for vaccination? As he knows, that's something the public health directors on the ground have been calling for. I hope we can listen to him. But he knows, because we've had these debates before in the House, that even if we drive up vaccination to as high as it possibly can go amongst adults, there are still around 20% of the wider population, i.e. children, who remain unvaccinated, which means the virus can still spread. The CDC in the US is moving to vaccinate children, so can he update us on what progress he is making on that front here? And with respect to children, can he also just clarify to the House that he will know today that in many secondary schools mask wearing is no longer necessary? Can he just assure us that he thinks that is the right response in light of the data that he's been unveiling today? Secondly, he's announced extra surge testing, but he knows by now that surge testing must be backed up by proper sick pay and decent isolation support. That should have been fixed in the Queen's speech last week. Thirdly, more venues are opening up today, and in many of those venues they'll be spending a lot of time disinfecting surfaces like we do in here, for example, which is good and important. But we know so much more about this virus now. We know about airborne spread of the virus. So why aren't we supporting venues more with ventilation? What are we doing in supermarkets, shopping centres, larger venues where air circulates around the building? What are we doing to help them put in place COVID-secure air filtration systems? Fourthly, what he said about the NHS and the uptake of beds is welcome. But NHS staff, as he knows, are exhausted and they will be fearing another surge. So can he tell us what modelling has been shared with NHS leaders and what they are doing to prepare for any surge in admissions? And finally, Mr Deputy Speaker, the surge in this variant reminds us that we are not safe until everyone is safe. That is not a slogan, it's a fact. 3.3 million lives have been lost globally to this virus, and Dr Tedros from the WHO warns that we're on track for the second year of this pandemic to be far more deadly than the first. Only 0.3% of vaccine supply is going to low-income countries. Trickle-down vaccination is not an effective strategy for fighting this deadly virus. Not only do we have a moral responsibility to play our part internationally, it also reduces the risk of new variants bouncing back at us and setting us back. So at this critical time, when we need to work internationally to defeat this virus, why are we the only G7 nation cutting our aid budgets? How can he defend cutting our contribution to vital science and research projects? And given the total silence from the government on President Biden's support for the temporary lifting of patent protections to increase vaccine production, should we assume that this government does not agree with President Biden?
Secretary of State.
Right, thank you very much, Mr. Speaker. If I address the substantive questions that he asked, the first question was about the surging of both vaccines and testing into these hotspots. And we've seen in South London earlier in the month and last month that this sort of surge testing can work. We had an outbreak of the South African variant in South London. We put in over 200,000 tests, and we effectively managed to contain that outbreak. That is the approach that we're taking in Bolton and in Blackburn, and we will also take that approach if we see a further spread in other areas of the country. It's something that we have been working very hard on to ensure that we have that capacity and that we can do that effectively. And we do that, of course, hand in glove with the local authorities in question who know the communities on the ground. We're also making sure that we have the vaccines available. But I want to be absolutely crystal clear about the approach to vaccination, because he asked about vaccinating all over 18s in Bolton and in Blackburn. That is not our approach. I have looked into it in great detail and we have taken clinical advice. The approach is to make sure we get as many second vaccinations done as possible, as many first vaccinations amongst the vulnerable groups, and then as many vaccinations as possible for those eligible groups who are under the age of 50. And the reason that we've taken this approach is because that is what is most likely to save most lives. That second jab is absolutely vital. And of course, the first jab for anybody over 50 could be the difference between life and death. And so the very strong focus is to get the vaccine into to all those over 50s who have not yet taken the first jab. And I'm glad to say that there are reports from both Bolton and Blackburn that uptake amongst people who are eligible but haven't yet got the jab has increased since we saw the rise of the B1617.2 variant in those areas. I think because it's effective in proving to people that the jab really does work to protect you. That is what the data shows. He asked about children. I've been closely following the results of the clinical studies from Pfizer that show that the vaccine is safe and effective amongst children between the ages of 12 and 18. We have procured enough Pfizer to be able to use the Pfizer jab and offer it to children, should that be clinically approved here. But given that we're at the stage of opening tomorrow to people aged 37, there's some time to go until we'll reach to 18-year-olds. We're on track to meet the target of offering the vaccine to all those age 18 above by the end of July. So we have a couple of months before we need to make and operationalise a decision, and we want to be very, very careful and sensitive around whether and how to offer the vaccine to children. He asked about wider measures which are important. Ventilation, he mentioned, and we have put in place guidance for businesses in terms of strengthening the rules around ventilation, and that too is important. He did a bit of a Captain Hindsight act, I thought, when it came to the Indian variant. He didn't seem to mention that we put India on the red list before this variant was deemed a variant even under investigation, let alone a variant of concern. And indeed, we put India on the red list before other countries like Germany and Canada stopped flights from India. We have a strong policy of restrictions at the border, and we will remain vigilant. The final thing I wanted to respond to was his point about the global moral responsibility to vaccinate everybody in the world. He's absolutely right that we have a global moral responsibility, and I would argue that the United Kingdom has done thus far and will do more than any other nation. It's not just about the huge sums that we've put into COVAX, but it's about the way that we've delivered the Oxford-AstraZeneca vaccine around the world. As of this morning, there were 1.47 billion vaccines that have been delivered globally. 400 million of those have been the Oxford-AstraZeneca vaccine. And AstraZeneca has charged a profit margin and a margin for intellectual property of 0. No charge for intellectual property, no profit for AstraZeneca. Costs, of course, need to be met, but we have taken nothing for the money that we've put in to the development of this. This is the biggest gift that this country could give to the world. 65% of those 400 million doses have been delivered into arms of people in low and middle income countries, including over 150 million in India. Of the COVAX facility, which is the biggest global effort to vaccinate in low and middle income countries, they have delivered 54 million vaccines so far. 53 million of those have been done with the Oxford-AstraZeneca vaccine. This country can be hugely proud of the contribution we've made. It's far bigger so far than any other country, because we decided, and we took the view from the start, the UK approach, which is you don't need to change your IP rules, you don't need to change the law, we just get on and get this vaccine out to as many people around the world as possible at cost. Everybody in this House should be very, very proud of what AstraZeneca and Oxford University have done with the support of the UK government, and that is how we save lives around the world.
Jeremy Hunt.
Mr Deputy Speaker, many of these new variants come from abroad, so clarity on borders policy is essential. We know that the first wave, now we know, was largely seeded from people coming back from their spring holiday break in Italy, France and Spain. So could I ask him for absolute clarity on the amber list? Should my constituents in Farnham, Godalming and Hazelmere, or all of our constituents, go on holiday to countries on that amber list, even when it is no longer illegal?
Mr Speaker, the answer is no. The official government advice is very clear that people should not travel to amber or red list countries or territories. People should not travel to amber list countries for a holiday. These lists of what's on the amber list, what's on the red list and what's on the green list are kept under review based on the data that is assessed by the Joint Biosecurity Centre. Our priority is protecting the progress that we've made at home, and we will assess any new countries that might go onto the green list every 3 weeks, and of course constantly monitor to check that the countries on the green list remain safe. But if it isn't on the green list, then unless you have an exceptional reason, you shouldn't be travelling there.
Video link. Dr Philippa Whitford.
Thank you very much, Mr Deputy Speaker. COVID cases in India began to soar at the start of April. So why were Pakistan and Bangladesh added to the red list at that time, but not India? Was it because of the Prime Minister's planned trade visit? After finally adding India to the red list on the 19th of April, it didn't take effect until the 23rd. How many people arrived from India in those days trying to escape going into hotel quarantine? When I previously raised the issue of applying hotel quarantine to all travellers, the Secretary of State claimed the current system was protecting the UK. Does he now accept that the entry and community spread of the Indian variant shows this simply isn't the case, and that having a negative test doesn't rule out that travellers are carrying COVID? SAGE has stated that evidence shows the B1617.2 Indian variant is up to 50% more infectious than the Kent variant, and have advised that, as in Scotland, areas with rising cases should remain under COVID restrictions. The Indian variant has been doubling every week despite lockdown. So why is he ignoring SAGE advice and opening up areas like Bolton that have exponential growth? Thankfully, this variant doesn't show significant vaccine resistance, but he must know it isn't possible to outrun the virus through vaccination alone. With those up to 35 not eligible for surge vaccination, this leaves a large pool of unvaccinated people in whom the variant can spread. And even those who receive a vaccine in the coming weeks, it will take 2 to 3 weeks before they are protected. Does he not accept that this variant is in danger of surging and that without local travel restrictions will spread to other areas? While it's good news that fully vaccinated people aren't ending up in hospital, just letting it spread among young adults could allow the evolution of yet another UK variant.
Secretary of State.
Thank you, Mr. Deputy Speaker. I answered these questions in the response to the honourable gentleman. The truth is that when we put Pakistan on the red list, and indeed Bangladesh,